Welcome. It is Friday, 12 p.m. here on the East Coast. It is that time for Ask Dr. Geier Live. Wherever you're watching, hope you're making today your masterpiece. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. I hope you're having a wonderful start to your weekend wherever you are. I will stay for a few minutes or I'll stay for a long time if you have questions, so leave those in the chat for YouTube, not in the comments. I cannot see the comments. All I can see are ones left in the chat. If you're on Twitter, we have been struggling to get the comments that people put in replies. They're not coming through to us through Restream. So if you put something there and you're not getting an answer, come on over to YouTube and do it there. As always, I cannot give you specific medical advice in response to any of these questions. I know it's Ask Dr. Geier Live, and I will give you a good answer, but it's going to be information and education, but it will not be specifically telling you what to do. I haven't seen you as a patient. I haven't examined you, looked at x-rays, looked at MRIs, so I cannot give you medical advice. I'm not your doctor. You're not my patient. If you'd like to see me as a doctor, there's information in the video description below. Click that link. That takes you to my website. You'll fill out a quick little form that gets to me and my assistant, and we will work on helping you decide if I would potentially be the right person to see you, and we'll work on helping to set that up. So with all that being said, that's what I have to say. Good to see you. Thanks for joining. Like I say, ask questions, or we'll make it really short. One thing that, just so you know, while people have any questions coming in, sometime hopefully in July, I'm going to start probably monthly. I don't know if I'll do it monthly, but it's already created. Now I've just got to create the back-end infrastructure. I'm creating roughly an hour-long webinar that will be completely free for anybody that wants to watch it and participate, but it'll be a webinar on how to get rid of joint pain in as little as 30 days without surgery and without cortisone. So stay tuned on this YouTube channel. If you're on YouTube, I'll put more information about it as it gets closer, or go to my contact page. You can get a free copy of my ebook, The Arthritis Solution, and you'll hear about it through that mailing list as well. But that's probably coming mid-July, I'm hoping. Like I said, I just got the kinks worked out on the running the webinar side today, but now we got to build the back end and that kind of thing. But it shouldn't take us too much longer. So that is coming soon. If you want a much deeper dive in terms of what's wrong with current medicine and orthopedic surgery and the approach to joint pain and what might be a better approach, definitely stay up for that. Leave a question in the chat on YouTube. In the comments, I cannot see those, but wherever you're leaving these, leave a question. Does peptides work with shoulder impingement? It certainly could. I've never seen a study specifically for that. That would be really hard, I would imagine, even in animal studies, to know that they're dealing with shoulder rotator cuff impingement. Tears are easy. You just cut the rotator cuff or whatever muscle group or whatever tendon it is in the animal, and then see what the peptide does to get it to heal. Having said that, I do feel like it could be effective as part of the treatment. I've said this all along, that peptides can be great, but they rarely are complete game changers and they completely treat a problem. I feel like they're good as part of an overall package, an overall treatment plan with multiple different strategies. And that can be other peptides, that could be medications, that could be regenerative injections, that could be physical therapy, that could be modalities like hyperbaric oxygen or shockwave or any number of other things. And so, yes, do I feel like they could be helpful? Do I feel like that alone is likely to completely relieve the problem? Probably not, but certainly could be better off than if somebody that didn't try it. It would really depend on a lot of factors. If you're curious, the ones that I would expect most peptide experts would try for it would be either BPC 157 or thymosin beta 4, also known as TB4 or TB500. just in my opinion. All right, I think that's it. So no other questions. Remember, if you do want to see me as a patient, click the link in the description below. Yes, you will at some point have to come to Charleston. If you decide to become a patient, the treatments that I do cannot be done virtually for a couple of reasons. I can explain that once we start communicating by email, but definitely look into that. All right, one more, and then I'm going to take off, and that is Harsha. Physical exam, can you find out if it's an ACL partial tear? You can definitely tell a complete ACL tear by physical exam. Partial tears, probably not if enough of the ligament is intact that it's basically still stabilizing the knee. Then you wouldn't have the increased translation and the knee would not pivot. It would not basically demonstrate that it's unstable. I've said many, many times, including several times on this Ask Dr. Geier Live in different weeks, I don't believe there are too many true partial ACL tears. Almost all of what radiologists read as a partial ACL tear on an MRI is what's called a high-grade partial tear. And if you look at it, there's a bone bruise pattern that tells you pretty much that the knee is unstable. It's like a rope. When a rope breaks, it's not just a few of the fibers, it's completely explodes. There may be a couple fibers hanging on, but there's very little that's holding the rope together. This is very similar. So I've probably seen less than 10 true partial ACL tears where the knee was still grossly stable in my career. And I've been doing this now 18 years, and I've done well over 1,000 of those surgeries. So it's possible from a structural standpoint. And yes, if it was a truly stable partial ACL tear, no, you would not be able to tell that on physical exam. If it was unstable, even if there were a few fibers hanging on, you would be able to tell that by physical exam for sure. But that's also sometimes an indication for MRI. All right, thank you so much for watching. I'm very grateful for those of you that join. And in the future, if you missed this and are watching the replay live, join us the next time we do an Ask Dr. Geier Live show on a Friday, 12 p.m. Eastern Time. Have a wonderful weekend, and I will see you all